Hey everybody, Alex Newman here. We are still at the Red Pill Expo, and I have with me Nathan Gjovik. He is the author of this book, Netherworld, Reflections on Working for the U.S. Government. He's worked for 4 different departments, and he became a whistleblower after seeing the corruption. And Nathan, thank you for being with us. Tell us a little bit about the corruption that you witnessed.
The first major corruption that I saw was I was a commissioned officer with the U.S. Public Health Service. These are the same guys that have been telling us to wear masks over the past year. I was assigned to an Indian Health Service hospital here in Rapid City. The CEO of the hospital, who is my supervisor, asked me to participate in a double funding scheme for the benefit of one of the local tribes. I refused to do that. I blew the whistle. I called the Inspector General's office, and within a week I was given a career-ending performance evaluation. I was demoted and transferred, all things that are strictly prohibited by the Whistleblower Protection Act. Nobody did anything, nobody cared, until I wrote the book sometime later, and then quietly all of these, what I would call perps that were involved in doing the things that they did to me, started disappearing, because I think they understood that they might get discovered through the publication of the book.
So were they fired, or what happened?
I don't know that the book was necessarily the reason for it, but like I said, they quietly were removed. One of them was another commissioned officer, and it's my understanding that he was demoted, defrocked, and dishonorably discharged. There was one gentleman that went to prison for, I don't know if it was, I don't think it was necessarily directly related to the book, but there were a number of people that went away, and they were senior level people. So it was a sad state of affairs. After I retired from the U.S. Public Health Service, I went to work for the Department of Homeland Security. I worked there for about a year. I'm an engineer, and so it wasn't really in my wheelhouse. I ended up ultimately getting a job with the Fargo VA medical system. At that time, they had the Obama shovel-ready stimulus funding was working its way through. The Fargo VA system had several major projects. One of them was the addition of a new 4th story to the VA medical hospital. When I first landed there with the VA, a team of safety inspectors had just coincidentally arrived, and it was just something that they did annually. They went through everything on campus. They ended up finding a number of egregious safety violations on my project site. And again, I had just arrived, so I was not aware of what was going on fully. I keyed in on that contractor and found out that the issues that were illuminated by the VA safety staff were just the tip of the iceberg. There were major issues, safety issues involved there, to the point where I was convinced that somebody was going to die at any moment. They had major safety issues. Nobody within the Fargo VA chain of command cared, because they had long-term relationships with that contractor's project manager, and so I ended up, as a last resort, turning to OSHA. I called the OSHA office in Bismarck, North Dakota. The gentleman that I spoke with up there apologized that he couldn't break anybody loose. They had everybody out working in the oil fields in western North Dakota. And then he asked me who the contractor was, and I told him. And there was a long pause, and then a sigh. And then he said, I'm surprised that they're even allowed to have a federal contract. And then he guided me to the OSHA violations webpage, and he showed me a litany of OSHA violations from that same contractor, including one recent death on scaffolding, which was the major issue that I had with that contractor. Net result was, again, it didn't matter. I brought this all to light for the VA chain of command. Nobody cared. I was the only registered professional engineer on staff there, and so if something happened, it was going to come down squarely on my shoulders. I ended up leaving the VA after 4 months of service there. I walked away from a $70,000 a year job just because basically of poor management and leadership.
Wow. So I guess there's corruption from top to bottom. That's pretty typical in your experiences. So I know you're an advocate of government reform. How do we reform this? Is it possible?
I think Trump was on the right track with the VA, but in both of those instances, I guess they were both related to government-sponsored health care, and so I think you have to ask yourself, is government or should government be in the business of providing health care? I don't know that there's nothing in the Constitution that I'm aware of that authorizes the federal government to be involved in providing health care at all. And I don't know why we as taxpayers would even want the federal government out there providing health care. I mean, if you think about it, we're paying a premium to have all of these facilities and all of these high-priced employees to get inferior health care. If we as a nation believe it's important to provide health care to some of these populations like indigenous people, Native Americans, veterans, then I'm thinking the better solution would be simply to voucher it. Allow these people to go and get care from private sector sources. If this is something that we as a nation believe is necessary, I don't know that, first off, that the government is even authorized to do this, to have all these facilities, to have all these employees to provide this care, and the care they provide is usually not good care. We already have a medical system set up in this country outside of federal systems. Allow all of these people to get this care through a voucher system. I think that's a better solution, in my opinion.
Yeah, absolutely. And so, Nathan, where can people get this book, Netherworld, Reflections on Working for the U.S. Government? Where is the best place to get that?
It is on Amazon. There are other outlets online. I've noticed that it seems like Amazon, at least Amazon, has been trying to kind of bury it. It's hard to find. You'll have to do a search for Netherworld and my last name, Gjovik, Gjovik, and that will get you the hit. That will get you to that site for that book. But otherwise, it's hard to find. I think that's by design. It tells a story that doesn't fit with what they want coming out. So it's a true story about all kinds of bad things that our government is doing, and I just hit on a couple of the things, but there's all kinds of racism and discrimination against white people, me as a white male in particular, that I experienced throughout my government service. So it's all documented in the book.
Very good. Well, Nathan, thank you for blowing the whistle. Thank you for speaking out, and thank you for being with us.
Thank you. It's a pleasure being here. It's an honor.
Excellent. Well, thank you so much, Nathan. Folks, that's Nathan Gjovik. He's the author of Netherworld. You can find it on Amazon. Stay tuned. We'll be back with much more.